Having a baby who just won't stop crying can be really tough. And although it may just be their way of communicating, which is exactly what Sarah's dog is doing right now, a crying baby can actually mean something more sinister. And that's what we're going to be talking about today. Today in Mother Doctor Nurse, we'll be covering reasons why your baby may be crying constantly. And the reasons we're going to look at today are around illnesses and injury. Obviously, going into detail and covering hundreds of things is beyond the scope of this, but we are going to chat about what we see most commonly and certainly what we get asked about too. But always, we're happy to take questions. I can't give specific medical advice, but certainly please just comment in terms of what your worries are and what you've experienced.
Yeah, absolutely.
And sorry?
I was going to say, and what we'd love too is that if you can tag people in the comments below who need this good information too, because, it's really important that we cut through all of the Dr. Google stuff and have some really good evidence-based info. So please don't forget to tag people too.
Great. And I almost forgot to tell you who we are. For those of you who don't know us, my name is Dr. Deb. I'm a holistic pediatrician and mum of 2 girls and 2 dogs who are also in the room. So apologies if mine make any noise. And I'm with the wonderful Sarah Hunstead, pediatric nurse and founder of CPR Kids, and mum to 2 girls and 1 dog.
Yes. And one very noisy dog who's very, very cranky at the moment. She keeps trying to talk to me at the moment. But yes, anyway, we'll just try and ignore her. What they say, never work with children or dogs or animals.
I know.
I can see why.
Yeah.
So we're going to continue on from, obviously, as you were saying, from our first series on Why Is My Baby Crying? So I'd love to start with illness, Deb. What are some particular illnesses that, where our baby is constantly crying, we're not sure what's going on? What should we be thinking about?
Great. Look, I think bottom line is any illness can make a baby feel crook, make them feel cranky, and they can just cry. The kind of things, though, that we look for that would alert me to something more sinister are obviously a fever, if your baby has a fever. And the younger your baby, the more serious it is if they have a fever. We've spoken at length about fever in other episodes, so I won't go into that today. But you can search through our previous episodes. So if a baby has a fever, they're going to not be feeling well and they may be crying. The cause of the fever, again, is numerous. The most common cause in any child is going to be a viral infection, but that can also make them feel bad, and that can also make them sick. The kind of things I think of with an inconsolable baby, one, the most serious being something like meningitis or encephalitis, and that's a brain infection. And yes, it's as serious as it sounds. And, the classic sign that we get there with the cry is often there's a change in the pitch of the cry, but that's not consistent. And, the message there is if your baby has a fever and they're crying inconsolably, they always need to be reviewed urgently.
Yeah, absolutely.
Other things that I think of, other infections that may be, a little less serious, are things like an ear infection. It can be difficult to detect an ear infection in young babies, one, because they're not all that common. So people often don't look in their ears. And here I'm talking about, that under 6-month age. And often they don't have specific localizing signs. What do I mean by that? They're often, older children, obviously, communicable children, obviously able to say my ear is sore, but older children often tug on an ear or rub their ear. But as you can imagine, a little baby doesn't have the developmental ability to do that yet. So they may just be crying. And the other reason is that it can be difficult to actually see a baby's eardrum. And that's just a factor of the size and, not squirming or anything. And we've done talks about that before, and I've also got something on my Instagram about how to hold babies. But certainly I think it's worthwhile persevering and making sure that your doctor has a good look at the eardrums. The other infection I guess I just wanted to mention was a urinary tract infection. So it's one of those, like a hidden infection in babies, because it's often often doesn't present as it would in us. For adults, or older children, it's often the classic of that desire to go all the time. So the frequency of urination, the burning, so the pain when you urinate. Um,
Yep.
exactly. Or the urine itself may become darker, discolored, cloudy,
Mm.
etc., or smelly.
Mm.
So it's not always so clear in young children. And it is one of those things that should always be excluded in an unsettled baby or a
Mm.
baby with a fever without any obvious clinical source.
Yeah, absolutely. And they may also be vomiting too. So,
Yes,
one
good one.
of the things that certainly sticks out in my mind from my years at triage in an emergency department is people coming in and those two things with a young baby saying that they're unsettled, they're crying more than usual, they can't settle them properly, and they're having some vomits and they're not wanting to feed. And so there are those sorts of things that, you've got to go, oh, hang on a sec, we need this checked out. And that's an important thing.
100%. And Sarah, just talking on that vomiting thing, I was
Mm.
always taught that vomiting alone is not gastro. You always
Mhm.
have to look for another cause.
Absolutely. Definitely. That is true. So we've talked about some of the illnesses, but what about some injuries? I mean, it seems pretty obvious that, if, you're in pain, we certainly will often, you might get a few tears in your eyes. You may well be crying your eyes out. And that's something that we want to express our pain. So, of course, when it comes to injury, crying from pain is something that we'd expect that's normal. But what are some other injuries that you can think of that may just result in not anything obvious apart from a crying baby?
Um, the one that always pops to mind with babies, and I know, Sarah, you do some wonderful teaching around this, is hair tourniquets.
Mm.
And what is that? Well, I have long hair. Sarah also has long hair.
Mhm.
Um, what it is if a baby gets a strand of hair
Mhm.
wrapped around any kind of appendage, so it can be a finger, it can be a toe, it can even be a penis.
Mhm.
If it gets wrapped around the tip, it acts like a tourniquet. So in other words, it changes the blood flow and drainage, and it results in the end becoming swollen,
Mhm.
tender, very painful, and ultimately, it can actually become like compromised in terms of the
Mm.
blood supply.
Yep.
So that's one of the things we will always do to a baby who's unsettled is really, really examine that baby, from head to toe in terms of, are there any injuries or hair tourniquets. Um, the other injury that is obviously much more serious is a non-accidental injury. So here we're talking about a baby who has been mistreated, hurt, whether it's a baby that's been shaken,
Mhm.
or a baby that, perhaps is a broken limb that no one's aware of. So it really is a full assessment of a child in terms of any possible injury. And I think the Sarah, the one thing I also just wanted to touch on today is having an unsettled baby is an incredibly difficult space to sit in as a parent, or as a carer.
Yeah.
And it automatically puts that baby at higher risk of
Mhm.
non-accidental injury. And I just want to stress to families who are experiencing any stress, distress, reach out. There are options in terms of people to talk to, people out there to give you help, whether it's those, who are close to you, family, friends, or organizations. And maybe, Sarah, we can just post a few
Yeah.
um,
Absolutely.
in
I'll do
in the
that.
comments for families, because you know I do think that, as I said, having a crying baby is possibly one of the worst things to have to cope with as a parent.
Yep, absolutely. I agree, especially when you feel so helpless yourself with that little human who you're responsible for. That feeling of helplessness is just awful. And yeah,
Mm,
absolutely.
mm,
And I will put some resources down in the comments below, not only for medical reasons, but also support as well. So I'll pop that down there. So please make sure that
okay.
you have a look at those if you need to. Really important. If
Mm,
anybody has any questions about what we've been talking about so far today, please put them in the comments below now as well, and we will endeavour to answer them. But one thing about the hair tourniquets as well, one thing I have seen is making sure that you check the inside of your little one's sleeping bag and their onesies as well if you're putting them without socks on, or even the inside of the socks, because I have seen incredibly fine cotton that has
mm,
managed to wind its way around as well. So just check that you don't have loose threads in the toes of the onesies and or any of the mittens or socks that you're putting on as well. So that's
Mm,
an important thing to check regularly, because after they've been through the wash a few times, it does tend to happen. Now,
mm.
Deb, is there anything else that you wanted to talk about in terms of illness or injury today before we finish up?
Well, look, we haven't spoken about insect bites, and I think, living in Australia, that's something that
Mhm.
we should always consider. And
Yes.
again, that's a good top to toe look of your child.
Mhm.
Um, just to look for any lesions. I haven't spoken about reflux or specific tummy pain, from other causes, things like constipation,
Yep.
because I thought that maybe we'd devote a whole session to that.
I think we should.
Um, yeah, yeah, but that's definitely one of the reasons why your baby could be crying,
Absolutely.
inconsolably.
And I'd love to talk a little bit more about those insect bites just for a second, if you don't mind too, because it's one of my areas of interest.
Well, I was about to say, I'm going to hand over to you for that one, Sarah.
Yeah, absolutely. So when we think about, let's go straight to snake and spider bite. So often with, your big black spiders, such as your mouse spiders, your funnel webs, and so on, they're large when they actually do bite. You can often see, one
Excuse
or
me.
two puncture wounds as well, because they can be quite large. However, with some bites as well, even, if you take a brown snake, for example, you may not actually see the bite site. It may actually just look like a scratch. You may just see a reddened area. You may not see what you see in Hollywood, where the two fang marks that have gone in. It's not necessarily going to look like that. So you may see a reddened area. You may see a scratch, but your child often will be crying inconsolably. Absolutely. The other thing too, something that's a lot more common in kids, well, not in kids actually, I should take that back. Something that's a lot more common in your backyard around Australia as a whole is a redback spider. So snakes, yes, we do have a lot of those around. Funnel webs, yes, in funnel web areas, but redbacks, they're everywhere. I live about, I don't know, 6 kilometres from the city, and I have redbacks all through my house. And Deb, I have no doubt that you do too. We're both on Bidjigal land here, so there are a lot of redbacks around. They are incredibly, incredibly, incredibly painful bites. We don't see them often in little babies at all, because generally it's when kids are going and poking around, under logs,
Toddlers.
in hot
Mm.
plants. Yes, all of those little places they like to hide along, the backyard fence and so on. And I remember distinctly a little girl who came into the emergency department, and her mum brought her in not knowing what was wrong with her. She was about 2 and she was screaming. She had been screaming constantly for 45 minutes. Her mum had no idea what was going on. She'd been playing in the yard and then was just beside herself. Doctor who was looking after her, first thing that she did was look her over for a spider bite or any kind of bite, as amongst other things. And she actually saw a reddened area with lots of what looked like beads of sweat around it. And that's often what a redback spider bite will look like. And they are incredibly, incredibly, incredibly painful. And it is a medical emergency in the young and the old. So if you get bitten by a redback, then you know what? Unless you're in extreme pain, you're probably going to be okay. Simply apply a cold pack over the top. But for a child or the elderly, it is still a medical emergency and you need to seek medical help. So, and remember, it's not always that you would see that patch of sweat around that area. You might just have a child who's completely inconsolable. So if that happens, please seek medical help. And the other thing that we really want you to do too is remember to trust your instincts. If that cry is different, if you're thinking this is not normal, this is different to what my child does, I don't know what's going on, I need help here, please go and seek it. Please. It's so important. Okay. Anything else you want to talk about, Deb, before we finish up?
No, I think we've covered some important things to be aware of.
Okay, excellent. Well, we will see you again next week, same time, same place. And remember, please, as always, We want to do what you want to listen to. So pop in the comments below, or even better, DM us about the subjects you would like to talk about. Okay, we'll see you soon. Bye-bye.
Bye.